Welcome back to my channel, and if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at greater pelvis. The greater pelvis can also be referred to as the false pelvis. Let's try and use this image by the side here to illustrate where the greater pelvis is located. This is the configuration of the pelvic bone, and within the pelvic bone, we have the pelvic cavity. This pelvic cavity is further subdivided into the greater pelvis and the lesser pelvis. And this subdivision is done by the pelvic inlet. And this is what is seen to be highlighted here in dotted blue. This pelvic inlet can also be referred to as the pelvic brim. And it is this alignment that further subdivides the entire pelvic cavity into the greater pelvis, that is the region of the pelvic cavity that is located superior or above the pelvic inlet, while we have the lesser pelvis, which is the region of the pelvic cavity that is located inferior to the pelvic inlet or the pelvic brim. So you have the entire pelvic cavity further subdivided into the greater pelvis above and the lesser pelvis below. In this lecture, we'll be focusing on the greater pelvis, which is this region here that is arrowed in red. So ride on with me as we highlight the anatomical configuration of the greater pelvis, the different structures that are seen to form the borders of the greater pelvis, and also the different organs that are located within the space. So the greater pelvis, we say that it is the superior part of the pelvic cavity that is seen or located above the pelvic brim or the pelvic inlet. This is where we have the pelvic inlet here, highlighted in dotted red. And this is what we say further subdivides the entire pelvic cavity into the greater pelvis above and the lesser pelvis below. For the greater pelvis, it is located or bounded inferiorly by this pelvic inlet. And this is what is highlighted here in dotted red, while superiorly we have the iliac crest. This iliac crest is what is arrowed here at this point. The iliac crest is the most superior margin of the ala of the ilium or the wing of the ilium. At this region here is where we have the hip bone. We know that the entire pelvic bone is made up of two hip bones, one on the right side and the other on the left side. If we drive in more into the hip bone on each side, we have three structural components of the hip bone. We have the ilium at the superior part, we have the pubic at the anterior part here, and at the posterior part behind is where we have the ischium. So the ilium at this superior part, we have a superior extension of the ilium here that is referred to as the ala of the ilium or the wing of the ilium, because it looks like the wing of a butterfly. So the most superior margin of the wing of the ilium is what is referred to as the iliac crest. And this region is what marks the superior limit of the greater pelvis. So it is this region that is carved out here in yellow, where it is the space that is located between the pelvic brim or the pelvic inlet inferiorly and also the iliac crest superiorly. The greater pelvis is considered as the lower part of the abdominal space. And if you look up here, it is where we have the abdominal cavity. So the greater pelvis is considered as part of the abdominal space, because if you look at this configuration, you see that this region that is carved out here in yellow is seen to be positioned at the lower part of the abdominal space. And this region is what is referred to as the greater pelvis. And if you look deep into the greater pelvis, you say that this greater pelvis is referred to as the greater pelvis because it is the region of the pelvic cavity that is located above the pelvic brim. So it is greater, while the lesser pelvis is located inferior to the pelvic brim, so it is lesser. So for the greater pelvis, it is also referred to as the false pelvis. It is the false pelvis because majority of the pelvic viscera are not seen within this region. and that is why it is so referred to as the false pelvis. Why the lesser pelvis is also referred to as the true pelvis, because majority of the pelvic viscera are located within the lesser pelvis. So if you look at this configuration, you see that the greater pelvis, which is also referred to as the false pelvis, is taking up the lower portion or lower region of the abdominal space. So that is why it is considered also as a lower abdominal region. This greater pelvis or false pelvis has less clinical importance when compared with the lesser or the true pelvis. If you look at the greater pelvis, you see that it has a less bony configuration. The borders of the greater pelvis that are seen to be formed by bone are just the posterior and the lateral borders, while on the anterior border, it is seen to be limited by anterior abdominal wall. The lesser pelvis is seen to be bounded more by bony configuration around its anterior, lateral, and also its posterior borders. And this tends to project a more clinical importance, especially as it relates to vaginal birth, because this bony alignment needs to be configured in such a way that is going to allow for the easy passage of the baby during vaginal birth, while the greater pelvis is less clinically important in this regard because it has less bony boundaries, and this is not seen to affect vaginal birth. So let's try and take each of the borders of the greater or the false pelvis one after the other to see the structures that are seen to limit this space. Considering this image by the side, this is where we say we have the pelvic inlet or the pelvic brim. This is what marks the inferior limit of the greater pelvis or the false pelvis. And at this region that is carved out here in blue is where we have the greater pelvis. So the anteriorly, it is bounded by the anterior abdominal wall. Specifically, it is the lower part of the anterior abdominal wall. Remember, we said that this greater pelvis is continuous superiorly with the abdominal cavity. So there's going to be an extension from the abdominal region down to the anterior region of the greater pelvis. So this extension also will be marking the anterior border of the greater pelvis. Then going to the posterior border, posteriorly it is bounded by the lumbar vertebrae, specifically by the fourth and the fifth lumbar vertebrae. We know that this lumbar vertebrae are seen at the superior part of the sacrum, and we know that the sacrum is seen to form the posterior border of the lesser pelvis. Quite superiorly above the pelvic brim, what we have is the lumbar vertebrae. So the last two lumbar vertebrae will be seen to border the greater pelvis at the posterior part. We also see the sacroiliac joint. The sacroiliac joint, as I've always said on this channel, is just for us to break down the name. This is the joint that is created here between the sacrum and also the ilium. This is where we have the sacrum here on this side, and this is where we have the ilium. So you now see part of the sacroiliac joint also forming the posterior border of the greater pelvis or the false pelvis. But specifically, it is the upper part of the sacroiliac joint that will be seen to form this alignment. If you go back to the lower part of the sacroiliac joint, you see that it's seen to form the posterior border of the lesser pelvis at the inferior part. So it is the upper part of the sacroiliac joint that is seen to contribute to the posterior alignment of the greater pelvis or the false pelvis. So let's go to the lateral wall. The lateral wall of the greater pelvis is formed by the iliac fossa. Remember when we tried to establish the different structural components of the hip bone, we say we have the ilium at the upper part. At the anterior part here, we have the pubic, and at the posterior part here, we have the ischium. So this upper region is where we have the ilium, and this butterfly-shaped expansion of the ilium is referred to as the ala of the ilium or the wing of the ilium. This structure is seen to possess an indentation or a fossa, and this fossa is what is referred to as the iliac fossa. So on the lateral side of the greater pelvis, you see this iliac fossa bounding it on laterally. This iliac fossa is not also seen to be empty. It is seen to be padded up by the iliacus muscle, and this is what is highlighted at this region. So the iliac fossa, together with the iliacus muscle that is seen to be embedded within the iliac fossa, are seen to form the lateral border of the greater pelvis. So if we try to revisit the inferior limit and also the superior limit of the greater pelvis, let's try and use this image here by the side. This is where we say we have the pelvic inlet or the pelvic brim. This is is what marks the inferior limit of the greater pelvis. And if you go more superiorly above this region that is harrowed here in green, is where we have the iliac crest. This iliac crest is what marks the superior limit of the greater pelvis. So this region that is carved out here in blue is the greater pelvis. So superiorly, we say that the greater pelvis becomes continuous with the abdominal cavity. This is where we have the abdominal cavity up here, and superiorly it becomes continuous with this space, while inferiorly by the pelvic brim or the pelvic inlet. And this is what is demarcated here in dotted red. So it's good for us to be able to establish the inferior limit and also the superior limit of this space. So now going to the content of the greater pelvis, let's try and use this image here by the side. This region that is carved out in dotted red is the limit that is created by the pelvic inlet or the pelvic brim. And we know that inferior to this space is where we have the lesser pelvis or the true pelvis, while superiorly is where we have the greater pelvis or the false pelvis. So if you go to the greater pelvis, the structure that you see at the terminal region of the gastrointestinal tract, and this is what is demarcated here in this region. And specifically, the regions that are located within this space include the ileum. We know that the ileum is the terminal part of the small intestine, and the ileum is also seen to be positioned within the greater pelvis. We also see the cecum. The cecum is the initial segment of the large intestine. Then we have the appendix, the finger-like structure that projects on the wall of the cecum. This structure is also seen to be positioned within the greater pelvis. Then we have the sigmoid colon. We know that the sigmoid colon is the region of the large intestine that is seen to be continuous with the rectum. And if we say we have the rectum located within the lesser pelvis or the true pelvis, it means the cecum will be located in the greater pelvis. We've highlighted this in our lecture on the lesser pelvis or the true pelvis. If you've not checked that lecture up, please kindly go and do so. In that lecture, we established that the rectum is one of the structures that are located within the lesser pelvis. So it's good for us to be able to highlight the specific regions of the gastrointestinal tracts that are located within the greater pelvis. We also have the urinary bladder. This is the urinary bladder here, harrowed in yellow. The urinary bladder is positioned or seen within the greater pelvis when it is distended. So when it is empty, it is confined or limited within the lesser pelvis. But when it is filled, it's seen to extend into the greater pelvis. So it's good for us to be able to establish this specific occurrence that the urinary bladder will present in terms of its position within the lesser or the greater pelvis. So these are the organs that are located within the greater pelvis. So thanks for watching this video.